Joining me today is Heidi Austin from the Jacksonville Orthopedic Institute. And Heidi, you are a physical therapist?
Yes.
Can you give me a little bit about your background, when you decided you wanted to be a physical therapist, and where your path took you?
I went to undergrad in Connecticut and then grad school at the University of Pittsburgh. I always wanted a job where I could help people, and I enjoy working out myself, so I thought physical therapy would be a good fit for me.
So what kind of sports did you participate in high school, college?
In high school and college, I ran track and cross country. It's primarily a middle distance runner and a 400-meter hurdler, and then kind of got sick of that after a while and was searching for something new.
So that led you to the triathlon?
Yes.
And we're going to come back to that in just a minute, because you actively compete in triathlons now.
Yes, I do.
You see a wide variety of patients, I'm sure, at JOI, young, old. Can you give us a little background into what it's like being a physical therapist?
Definitely. So on an average day, I see anything from shoulder surgery, hip replacement, knee replacement, to professional athletes, the occasional shark, jaguar, sometimes a professional runner or swimmer. So it's a pretty big variety that makes it interesting and exciting on an average day.
Well, being with the Jacksonville Orthopedic Institute, as you mentioned, sometimes you get to see these professional athletes. Mm-hmm. I'm sure that's very interesting when they come in.
Definitely, just because treating a professional athlete or an athlete in general has its own different mentality. So,
well, I know there are a lot of things now that, even with people like me, I'm a weekend warrior, that, you know, physical therapists and doctors and procedures, just in the short time, and I say short time, you've been practicing now for what, 4 or 5 years?
Yes, sir.
Have you seen a lot of changes in terms of what's available to help people be active longer or stay in their sport longer?
Definitely. Technology is continuously improving and research is always improving, so I think people are able to exercise longer in life and live just in general better quality of lives and perform at a higher level at a later age.
Well, I'm sure when you see a runner come in, you probably can identify with them, or a swimmer or biker, you being a triathlete. What are some of the more common injuries that you'll see in someone that is very active?
One of the most common injuries in triathletes and runners especially is IT band syndrome, or usually it's just lateral knee pain. It's usually a result of poor mobility and, you know, weak glutes, weak core.
And how would you treat that?
Usually the best thing is some type of mobility, whether it's foam rolling. We have something called Graston technique to break up the adhesions along the IT band, and then stretching it, and then following that up with some solid glute and core strengthening.
What about preventing something like that?
I can't tell you enough as far as runners and triathletes how many people just neglect stretching, foam rolling, and just keeping up some semblance of core and glute strength.
But you hear all kind of myths about stretching. I mean, I've recently had someone that told me, well, stretching before you start really doesn't matter. It's more important after. I mean, what are the pros and cons of that?
So I'm a big advocate for an active warm-up. So for example, say you're going to go out for a run, maybe doing some leg swings, some lunging, maybe just some air squats, just to get the hips moving, the hips opened up, just to open the range of motion in the hips and the ankles. I'm not a big fan of stretching before either. I think it's better done afterwards, especially depending on what you're competing in or training for. But I think stretching is starting to be a thing of the past.
Really?
In a sense.
Do you stretch before you work out?
I try to do an active warm-up on most days, and then usually I will stretch after my runs.
So what about that hard-headed person? I know you see it in runners especially, who you tell them you need to take a break for a while and they don't want to. Is there anything that or what direction do you steer them in?
Unfortunately, usually they end up at my office, and then sometimes that scares them enough or motivates them enough to, you know, change their ways. But unfortunately, it usually takes getting to that point.
If there's any advice that you could give someone, be it a professional athlete or a weekend warrior like myself, or just someone that's wanting to be active, how would they go about starting a program and staying active? Is there any one or two pieces of advice you could give?
The biggest thing, I think, for me at least, I like having a plan and I like having goals. So, I mean, having a long-term goal to shoot forward, and then basically just having a structured plan to get to that point. I think a lot of people just go out there and do what they feel like, and it's quite haphazard, and that's what ends up getting them hurt.
Well, Heidi, thanks for being here today. We're going to get you back in here and talk a little bit about your active lifestyle and participating in triathlon.